Deputy Pearse Doherty, please.
Minister, I want to raise with you this afternoon the ongoing crisis in the child and adolescent mental health services CAMHS across the state. All of us know here parents and families that are struggling to access care for their children, and all of us have heard from staff working on the front line in the area which have drastically inadequate staffing levels which make it impossible to meet the demand for care that they want to provide. Figures provided by the HSE to my colleague, Chapta Louise O'Reilly, show that midway through this year, the waiting list for CAMHS services stood at over 2,700 children and young adults. And that's not a waiting list for treatment, Minister, but a waiting list for the very first step for initial assessment. And many young people are waiting a year and more to be assessed. And these are young lives that are in limbo. They are families that are at their wits' end, and they are a state that are failing our children. In some parts of the state, the waiting lists are absolutely shocking. In CHO1 area, which includes my own constituency of Donegal, we have a waiting list of 203 children at the end of last year. In CHO4 area, which includes Cork and Kerry, the waiting list was 737 children waiting for initial assessment for mental health services. It's an absolute scandal, Minister. We cannot continue this to allow these lists to grow and put more children at risk, because this is what this all boils down to. Our children are at risk because the state is failing to make sure that the needs and the care that they are asking for, that they are reaching out for, can be met. CAMHS is simply not meeting the needs of young people who are often in desperate need of immediate care. And this is primarily due to a result of a failure to recruit staff needed to fully operate the CAMHS teams. For some time, around half of the positions in the CAMHS teams have been vacant right across the state. Yet when this issue was raised in terms of the recruitment and retention yesterday by our party leader, Mary Lou MacDonald, surrounding nurses, including psychiatric nurses, the Taoiseach simply dismissed our concerns. What is needed is an immediate response, particularly in areas where the problem is at its worst. The Oireachtas Committee on the Future of Mental Health outlined earlier this year a raft of measures to improve the recruitment and retention of vital staff. By filling vacancies quickly and improving conditions, we can improve the services and attract more staff and keep the excellent staff we already have. When CAMHS are able to assess and care for young people, let me say this, they do an excellent job with very good results. But we can't allow a situation to persist where if a child or a young person needs the care, that they are going to be facing an extended period of wait that puts them and their mental health at very serious risk. We need to see dedicated action, Minister, in the area of mental health to attract new staff and to keep the excellent staff we had. And there was promises made, there was promises made last year by this government that the disastrous gapping staffing levels would be addressed in terms of CAMHS, but it hasn't. So, Minister, can I ask you, will you recommit to doing so, and will you ensure that it actually happens this time?
Minister.
Well, the answer to Deputy Doherty's question is yes. We will ensure that every effort is made to deal with this issue, and I do acknowledge that it is a challenge, and I acknowledge the importance of the issue as raised by Deputy Doherty. I want to assure the House that improving all aspects of CAMHS nationally is a priority for the Government, and Minister Jim Daly in particular. An additional £84 million will be provided for mental health services for 2019, which will bring the total available funding for mental health to €1 billion, an increase of 9%. But that's not all of the issue. And I do acknowledge what Deputy Doherty has said in respect of staffing and recruitment challenges. I want to acknowledge that that is a difficulty, and not only in terms of recruitment, but also in terms of retention, indeed right across the health system, but in particular in the area of mental health. I want to assure the House that every effort is being made on the part of the HSE to address this issue. I want also to say that at the capacity in primary care has been further developed recently through the funding of a further 114 assistant psychologists, 20 other psychologists, senior psychologists, and this will help to manage the demand for psychiatric services. But I also acknowledge that it's more than just that. There is also an issue in respect of the demand for psychiatric services, as well as psychological services. So I want to assure Deputy Doherty that the HSE, other agencies, and that the HSE in particular is working closely with appropriate recruitment agencies, and not only here within this jurisdiction but also on the national stage, in order to find suitable and appropriate consultant psychiatrists to deal with this issue. So on the one hand we have the increased resources. On the other hand, I believe it's important that every effort is made to ensure that we can attract a proper and adequate coterie of people to deal with what is a very serious problem across society.
Said, and I could go into the detail in terms of distilling down the figures and how much was spent in agency and how much of it was already pre-committed in 2017. But the reality is, for parents that are listening to this interaction today, they won't take any comfort from what you've said. Because I know personally these parents, and I'm sure you do as well. I know when they tell me that they are phoning the service on a weekly and sometimes a daily basis, that they're in tears, pleading, demanding, asking, begging that their child will get access to a service so that they can have the diagnosis and wraparound supports that that child needs. How they are telling our healthcare professionals that they're worried about their mental health, that they're worried that their child, sometimes as young as 8, 9 and 10, are self-harming or could take more drastic action. And while we've heard these commitments from government before, last year the waiting list has got longer. The amount of children that are waiting to be seen has got longer. The length of time that they're waiting has got longer. And the reality is, Minister, there is a failure here in government, and this is a microcosm of how this government is failing to plan to fulfil the needs of health in our society. Minister, and I'll finish on this, every single party in this House supports the full implementation of a vision for change. It is in your own programme for government. When can we come into this House and say that that is really an objective that will be realised? And when can we say to the 2,700 children and their parents that their children's need, their mental health needs, will be met by this date? Because this is not cherishing the children of the nation. This is cruelty and this is neglect of our children, and it is happening on your watch, a government that has been in office now for 8 years, and you need to take some, if not a lot, of that responsibility on your shoulders and act now.
Minister.
Well, can I say Deputy Doherty is not the only one who engages with parents and constituents on this issue. I do on a regular basis in the context of my constituency engagement, as indeed do all of my colleagues on this side of the House. And I do acknowledge the importance of the issue was raised, and I do acknowledge a determination on the part of government to deal with this matter in a satisfactory approach. I want to acknowledge the dedicated and designated functions of Minister Jim Daly, with particular responsibility for this area. And again, I want to repeat an increase in funding for next year to the tune of almost £1 billion budget for mental health services. An additional allocation of in excess of €50 million for new mental health developments across next year. If the Deputy requires a drilling down into the figures, as he mentioned, let me assure him and members that £35 million of this will be apportioned for new developments, while a further £20 million is for growth projects which are already commenced in this year. So the focus for funding for next year will be on early intervention, which again is a point raised by Deputy Doherty, and he's correct. Because the importance of early intervention is well known and accepted, and also support services which will assist people in dealing with mental health challenges before they may require acute psychiatric care. I want to again acknowledging, as I do, the challenge in respect of the recruitment and retention of staff, that every effort is being made by way of a very active approach on the part of Minister Daly, who is currently in discussions with local managers of HSE regions up and down the country in order to deal with the unacceptable level of waiting lists as itemised by the Deputy this morning.